How to get rid of a sinus infection. Ever told someone you are a bit under the weather? Well, that is what happens when you are suffering from a sinus infection. Here is what you should do so you can take care of it before it gets worse. First, try some home remedies. Some examples of these include steam therapy, drinking lots of liquid, getting enough rest, using heat packs, and taking some medicine. If you want to drink something else aside from orange juice or water, try drinking chicken soup or some tea. A lot of tea products are made from herbs, and you are sure to find one that will be likable to your taste. You can try eucalyptus, ginger, peppermint, licorice, lemon balm, and echinacea. Just be careful when you mix herbs with certain drugs because they may have a negative reaction to your body. You can also consult a homeopathic doctor who will prescribe medication that generally does not have any side effects compared to over-the-counter medication. Smoking causes sinus infections. If you happen to smoke regularly, cut it down gradually and then quit the habit. Many people are unaware that smoking damages the lining of the sinuses and causes swelling in the mucous membranes. Should you be suffering from an acute sinus infection, you will be back to normal within a week. But if this lasts longer, then you may be suffering from a chronic sinus infection and you will need to see a doctor. After doing some tests, the doctor will most likely prescribe some antibiotics which you have to take until you feel better if it has been determined that this was caused from bacteria. To reduce the swelling, you will also be given some corticosteroids which can be delivered directly through your nose. You might be prescribed antihistamines or decongestants which you can take orally. The only downside is that although it can help dry up or shrink the backed-up mucus, it is only temporary. Another way to loosen the dried mucus is through moisture or humidification. Your doctor will not give this to you but suggest that you buy a humidifier which you can use at home. Lastly, if the sinus infection is caused by an allergy, the only way to get rid of it is with immunotherapy, which is a technique that stimulates your antibodies. You can tell if what is given is working or not based on the color of your phlegm. If you spit out some and this is color yellow, it means that you are on your way to recovery. If this is color green, then a lot more has to be done to make it go away. If this is color brown or orange, there could be complications like pneumonia. Whatever happens, update your doctor regularly until so he or she can track your progress. Fighting a sinus infection could last a few days to a few weeks. Regardless if this is acute or chronic, you have to take action fast to prevent complications from taking place. If you think that a cold cannot do anything worse, think again, because there are times that this could put you into a coma or something fatal. So start out with home remedies, and if all else fails, get medical help. Sinus problems? No problem at all. We all know how it feels. We've felt the pain. The pressure builds until you think you can't handle it anymore. Your head feels like it's twice its normal size and ready to burst. You know what I am talking about: sinus problems and sinus infections, whatever you'd like to call them. They can really make your life miserable for weeks at a time, especially during the winter months. Sinusitis, most commonly known as sinus infection, happens when the sinuses get blocked and mucus and air cannot flow freely through them. Here's a statistic to think about: 30% of all people suffer from sinusitis at least once a year. Put that in perspective, and that means about 1.8 billion people suffer from one sinus infection or another during the year. This includes those who suffer short-term, acute, 1 to 3 weeks, long-term, chronic, 3 to 8 weeks, and recurrent, multiple times throughout the year, sinus problems. Sinus infection symptoms can hit you in a number of ways. They include fever, headache, runny nose or nasal congestion, cough, earache or ear infection, swelling around the eyes, upper jaw and toothache, tenderness around nose, ear, and cheeks, weakness or fatigue. Personally, sinus headaches make me want to die. I feel like I am in slow motion. A helicopter sounds like it is just above my head with its choppers going constantly. The pressure mounts in my sinus cavities and fills every hole from my brain to my face. I can't concentrate on anything and everyday tasks become burdens. I couldn't imagine dealing with sinus headaches on a regular basis. Nobody wants to go around feeling like that. Life's hard enough without your head beating like a drum. None of those are fun to experience. You have places to be, people to see, and things to do. You can't afford to be sick for lengthy periods of time. If you're part of that 30%, then you would probably like to know what you can do to prevent sinus infections from making your life a mess for weeks at a time. Simple activities, using a humidifier, and regularly cleansing nasal passages are a few good ways that can help decrease sinus infection symptoms. These symptoms can also be combated by using a nasal spray to clean, flush, and kill the harmful bacteria out of your nasal passages and sinus cavities. Sinus problems can really complicate your daily routine and make life miserable. So plan ahead and don't get stuck in slow motion from sinus infections. Causes of sinus infections. Sinus infections are more commonly known as sinusitis. It can definitely create a lot of pain and discomfort to the affected individual. To better understand your health condition, there is a need to determine its causes, and one way to do that is by consulting a medical professional. How can you tell if you have a sinus infection? Well, it's really easy, and you just need to look out for some symptoms such as a feeling of tenderness around your eyes, nose, forehead, and cheeks. Some patients even suffer from headaches, nose discharge, congestion, or fever, and cough. Most sinus infections are chronic, and so you will need an experienced doctor to avoid frequent occurrences in a year. With the proper treatment, you can get rid of your sinus infection in no time. Sinuses protect your skull. Sinuses come in 4 pairs which connect it to the nasal passages and the nostrils. When you're able to inhale germs, the infection will start. When the lining of your sinuses become inflamed, you will be suffering from a sinus infection. Common colds are the main reasons for sinusitis. When you have a cold, there tends to be congestion inside your nasal passages. The sinus's drainage is inhibited, thereby causing the inflammation. Scuba diving and flying can also cause sinusitis. You see, when you dive underwater or you fly up into the air, the pressure changes. This change in pressure can cause inflammation in the nasal passages, causing sinusitis. Pregnant women are more prone to sinus infections because of the changes in the hormone level inside the body. Because of the hormonal changes, the nasal passages tend to swell, causing discomfort and pain. Women who are taking contraceptives like pills are also prone to sinusitis because the pills trick the body into thinking that the person is pregnant, and in turn, it creates hormonal changes as well. Asthmatics are also at high risk of developing the infection. On most sinus infection cases, doctors prescribe antibiotics like amoxicillin, clarithromycin, and moxifloxacin. Depending on the severity of the infection and the age of the individual, the doctor can prescribe broad-spectrum or narrow-spectrum medications. Some medicines may cost big money, especially if the infection occurs frequently, but if it means reducing or eliminating the pain, anyone will be willing to spend that kind of money. To sum it all up, the causes of sinus infections are the following: when you inhale germs, common colds, change in pressure when scuba diving or flying, pregnancy, and the intake of birth control pills. If any of the situations applies to you, you will be at high risk of developing the infection as well. When you feel any pain around your eyes, nose, forehead, or cheek, take that as a warning and schedule an appointment with your doctor right away. Sinusitis can really cause a lot of pain and discomfort. There are several effective medicines like antibiotics that the doctor can prescribe. Consult your doctor now and have your condition examined. Once you're given a prescription, you need to follow all the instructions carefully. That way, your condition will get better and the pain will go away. Know the causes of sinusitis so that you can easily tell if you're exhibiting some of the symptoms. Sinus infections can be cured, so don't hesitate to visit your doctor. Preventing sinus infections. Sinus infections are infections that cause inflammation to the sinuses. Sinus attacks are caused by an infection in the sinuses or cavities that are present in the bones near the nose. When there is any swelling in these sinuses because of some infection, breathing becomes difficult, resulting in fever, headaches, and other discomforts. It is very important to recognize the exact symptoms and cause of the infection. Sinus infection treatments can vary vastly depending on the type of infection: acute up to 3 weeks, chronic 3 to 8 weeks or more, and recurring frequent attacks within a year. Sinus infections or the frequency of sinus attacks can be prevented to a certain extent. The best way is to avoid cold and bacterial infections by avoiding places that have too much humidity. This can be done by installing humidifiers in the room, keeping the humidity levels ideally at 45 to 50%. The air should not be too dry. If the air is too dry, you can try breathing through a moist towel. Air conditioners also have air purifying systems that do not allow bacteria to grow. Some people are more likely to have a sinus attack if they are susceptible to allergies. People who are prone to sinus attacks should avoid pollutants like cigarette smoke and even alcohol. They should also avoid places like swimming pools that have chlorine-treated water, since chlorine increases nasal irritation. Other things to be avoided are dust, pollen, mold, or any foods that trigger allergies. There are many tests to determine the vulnerability to certain irritants. Drinking a lot of water and other fluids every day would also help to combat sinus infections. Rest is also required. Avoid using too many over-the-counter medications, as these can augment the level of infection if not diagnosed properly.